Cardiac arrest is one of the emergency conditions that kills many people at home or in the pre-hospital setting. And today I'm going to teach you how to recognize cardiac arrest and the relevant first aid that is supposed to be given to the patient. Welcome to Emergency Kenya channel. Here we teach simple, basic, life-saving skills first aid. And today we're going to look at cardiac arrest. Cardiac arrest, it is a temporary or permanent cessation of heartbeat. What I mean is when your heart suddenly stops pumping blood. It becomes permanent when the patient die, and it becomes temporary if you can be able to do a resuscitation and the patient regain a heartbeat. How are you going to recognize cardiac arrest? Number one, it is sudden collapse, unexplained collapse, when the patient suddenly fall down and become unconscious. Number two, unresponsiveness. If you try to call their name, tap the shoulder, pinch the earlobe, do a sternal rub, and they are not be able to respond, that means the patient is unresponsive. Number three, it is lack of pulse or no pulse. If you feel for radial pulse, the radial pulse is just here at the wrist for 5 to 10 seconds, or the carotid pulse, and you are not be able to feel, then the patient doesn't have a pulse. And number four, it is lack of breathing or no breathing. If you look at the chest, you cannot be able to see chest rise and fall, then the patient is not breathing. How are you going now to manage this cardiac arrest or the first aid that you're going to give the patient? Now, just remember the mnemonic doctors CAB, DRSCAB. That is a mnemonic that you are supposed to remember when resuscitating a cardiac arrest patient. Number one, D stands for danger. Remember, you cannot work in an environment where there is no safety. You must make sure the environment you are in and you are initiating first aid, it is safe. Number two, responsiveness. After you have verified the environment is safe, now you check the responsiveness of the patient. Tap their shoulder, pinch their earlobe, do a sternal rub. If they are not able to respond immediately, call for help. Now that number three, S, send for help, that you are going to call for emergency medical services. As I have told you, remember, you cannot be able to manage a cardiac arrest patient alone. You need a team that can help resuscitate the patient. The most important team, it is the medical team, the one that has more skill in resuscitation of patient in cardiac arrest. After you have called for help, don't delay to start chest compression. That is number four, circulation. Remember, a patient in cardiac arrest, we have said, is when the heart has stopped pumping blood, so there's no circulation of blood in the body, and you need to help blood to circulate in the body manually. That's why we need chest compression. So you are going at the center of the chest, and then put the heel of the one arm and then interlock with the other one, and then you push hard and fast, but not too fast and not too slow. So that one, you're helping the heart manually to circulate the blood inside the body. The chest compression that you're supposed to give the patient is in the range of 100 to 120 chest compression, but you'll find it is when you do those 100 and 120 chest compression at once is so tiresome. So we break them in cycles of 30 chest compression. After each and every 30 chest compression, remember, this blood also needs purification. That's why we go for AB, airway and breathing. Airway and breathing, now you're giving rescue breath. So after you've given the 30 chest compression, you're going to give 2 rescue breath, okay, so that the blood can be purified. How are you going to give rescue breath? Remember, you as a first aider, you're also protecting yourself and also protecting the patient from coming into direct contact with other infectious fluids. The fluids may be within you or the patient, and those fluids, like saliva, can lead you to having HIV or other infectious diseases. So for you not to come into direct contact with the patient, you can protect yourself using the barriers. A barrier is like a plastic paper bag. You can use a plastic paper bag. You can just come and seal the mouth, make a hole inside the mouth or through the mouth, and then you blow inside, and you make sure you pinch the nose when giving those rescue breath using a plastic paper bag. Or you can improvise a pocket mask. You can just pick a bottle, cut a bottle, and then you place this cut side on the nose and the mouth. Then you make sure you make a complete seal, and then you blow the air inside through here. By that, you'll not be able to come into direct contact with the patient. You may not be able to know the condition of the patient, or even you yourself, you may have the condition that you don't know how to infect the patient. That is how we use. But again, don't delay chest compression. If you don't have anything that can help you give rescue breath, continue with chest compression until medical professions arrive with the gadget like a BVM that will help give the patient rescue breath, or a ventilator that can help the patient breathe. And then after that, remember the reason you call for emergency help, the patient may need an AED. An AED is a gadget that is used to shock the heart to help it jumpstart. Remember, chest compression alone cannot be able to help jumpstart the patient. Okay, but the patient heart. Okay, so we need a gadget like AED to help analyze the rhythm of the heart, whether it is shockable or non-shockable. If it's a shockable, we give a shock. If it's non-shockable, we continue with chest compression, of course, with other drugs of resuscitation like epinephrine. Remember, if the patient in cardiac arrest is not given chest compression immediately, in 4 minutes after recognition of that cardiac arrest, the brain cell may start dying. So it is important, once you have recognized, immediately start chest compression so that we can supply the brain with blood, oxygen, glucose, and nutrients that help the brain cells work. Not only the brain, also the other cells or the vital organs in the body. So you don't have to wait for this emergency to occur there at home or anywhere in the pre-hospital setting, so that you start learning first aid. Start learning first aid today. You may be the only help that the patient may need tomorrow, and it may be your family member, it may be your friends, it may be your neighbor, it may be a stranger. But if you have these skills, you will find you'll be able to help that patient to survive. So let us learn first aid, let us do first aid. That's why Emergency Kenya, today we have come to make first aid awareness across Kenya, so that we save lives there at home or in the pre-hospital setting, and we reduce the number of patients that die each and every year unrecognized because of conditions like first aid. This is Emergency Kenya. Please subscribe, like, share, follow, and let us learn a skill each and every day. This is Emergency Kenya. Till next time, bye bye, stay safe.